There have been so many negative effects, as we know, from the COVID pandemic, but tonight we're getting a clearer picture of its impact on another epidemic from opioid drug overdoses.
Yeah, today one number that's been made public really helps to put this into perspective. For the first time ever, more than 100,000 Americans have died from drug overdoses in a single 12-month period. The CDC reported today that from April 2020 to April 2021, 100,306 Americans died of overdoses, up from a little more than 78,000 in the previous year.
The head of the CDC's National Center for Health Statistics called the increase, quote, staggering. Deaths rose in every state but Delaware, New Hampshire, New Jersey, and South Dakota. Here in New York, deaths were up more than 20%, and more than 3/4 of the overdose deaths are attributed to opioids. And joining us live to talk more about this tonight is Brandy Vandermark Murray, Senior Vice President of Operations at Horizon Health Services. Brandy, thanks so much for joining us tonight.
Thank you for having me.
So we've heard throughout the pandemic the impact that it was having on overdoses, though the numbers that have been released now really make that impact pretty stark. Can you explain how you think the pandemic has resulted in this just awful increase that we're seeing?
Absolutely. With any addiction disorder, isolation and being away from others is really a trigger for people to increase use. Through the pandemic, we also saw a decrease in opportunity for conventional treatment, peer support groups, residential beds had to decrease due to COVID capacities and quarantines, and a lot of people through the pandemic were extremely stressed out, and so those maladaptive coping skills like using substances significantly increased, and we saw that with many of our patients in all of our locations.
And we know it was a problem before the pandemic as well, and it's often easy to not pay close attention to things that don't affect us personally. And one of the things about the opioid epidemic is that it sometimes caught people off guard, and people who never thought they'd be dealing with addiction found themselves dealing with it, often with devastating results. Are you concerned the problem now has really been overshadowed and isn't getting the attention it needs?
Absolutely. We have been seeing a steady increase in drug overdoses in the United States for the past 20 years. And in the past 10 years, it's been significant. We have been in an epidemic of an opioid crisis for the past 10 years. We were optimistic in 2016 when we started to see a decline, and specifically in Erie County. But in 2020, that significantly increased, and we were on a rise in the past 24 months. When we kind of transitioned to the COVID pandemic, people were still dying in our community. Right here in Western New York, so many families were impacted, and a lot of people were using recreational drugs, and unfortunately, fentanyl was laced in those drugs, and unintentional overdoses skyrocketed.
Yeah, Brandy, so clearly I think this shows us that we need to place more attention on this, right? What more do you think needs to be done here? I mean, the opioid crisis was just so bad even before we got here, and now to see these dramatic increases, I mean, what types of actions can our elected leaders, community leaders be doing to better deal with this?
I think we really need an all-hands-on-deck approach. We need our medical community to work in collaboration with our behavioral health community. We need prevention efforts to increase in schools because we still see young adults, when I say young adults, kids 14 to 18, abusing substances. We need our community to really challenge the stigma of asking for help. And so in all of our communities, this isn't a city issue or a suburban issue, this is an issue all across our nation. And we need people to really take those stigmas so people can say, I need help, and get the help that they need.
And on that note of asking for help, listening to this can certainly be hard for the thousands of Western New Yorkers that are touched by this crisis in one way or another, whether it's someone fighting with addiction or someone who knows someone who is. So what should they do? What help is available? And maybe I think sometimes this can be helpful as well. What are some things that you should not do in this situation?
Well, I think you are ready to ask for help, or even if you are contemplative around help, I think reaching out to some of our local resources. So Horizon Health Services has locations all across Western New York, and we offer outpatient services, detox services, residential services, and we have admissions open 7 days a week, and someone can call and ask even just for an inquiry or an appointment. We also have our Erie County hotline, 831-7007, that people can call and get support. But I think that what people shouldn't do is turn a blind eye. If you see concerns with someone that you love, ask a question, offer support, seek out some advice and education, because you never know when you say, do you need help, that someone can say, yes, I do, and really reach out for some support.
And Brandy, we know that 3/4 of the overdose deaths here, as we mentioned, were related to the opioid epidemic. That means a quarter aren't. How do you approach dealing with the opioid crisis versus drug overdoses generally as you look at these statistics?
Well, the other 25% often are things like cocaine or methamphetamines, and sometimes they're laced with opioids. But a lot of times overdoses are in conjunction with a mixture of substances. And so that can be things like Valium and alcohol. And we have people who have medical issues that can be compromised. And so when we think about opioids, yes, that is the #1 overdose risk factor that we're dealing with. But substance abuse across our nation is still very problematic. And I think making sure that we don't put one substance in a box and say it's not an issue, but really looking at behavioral change and if someone's isolating and someone's struggling and inquiring on what their needs are.
We've been chatting with Brandy Vandermark Murray, the Senior Vice President of Operations at Horizon Health Services. Brandy, thanks again for your time tonight.
Thank you so much.